Hi, good afternoon or good evening, everyone, depending which part of the country you're in. Welcome to this particular session of the BRMI presentation. Last month, we talked about the immune system in general, looking at sort of all aspects of the immune system. Tonight, we're going to focus on one specific area, specific allergies, which is obviously, for many people, will be a rather prevalent timing of things because of the fact that for many people, the summer becomes allergy season. So we're going to look at allergies from, a basic overview, how is it conventionally thought about, but how does biological medicine look at it, and why it's not just about going to the store or your doctor and asking for an antihistamine, and if that an over-the-counter one doesn't work, find a prescription one, because we're going to try and explore it more from the idea of why do you have allergies in the first place. But before we do that, we need to have a bit of an understanding as to, what is it in the first place. And, we look at it's not just in the United States, it's not just in Canada, that allergies have been a problem. We see that throughout the world, there's been this steady increase in prevalence globally, and now estimated that up to 40%, which is a pretty astounding number considering there's over 6 or 7 billion of us on the planet, of that many people of allergies. So we have to look, well, what are we doing? Like, how is this possible? And of course, some of it is, what are we doing to the planet? Overall, what have we been doing to the planet in the last 100 years that basically has resulted in this tremendously high escalation of allergies? And we need to be aware of what burden this is going to place on people, as children grow into adults. We also know that that there's this polysensitization that people are having, and the fact that allergies are not something that just affect our nose, affect our throat, runny eyes, sneezing, that type of thing, which obviously is one of the most common types of allergies that there are. But there's allergies that affect almost every organ system in the body, and so we need to be aware that symptoms that people have on an everyday basis, they may not be aware that allergies are in fact what their issue is. So it is believed that air pollution, of course, is a factor, and we know that the changing environment in the world, climate changes, is having a significant impact. Pollen people react to, and insects and that type of thing. But we need to look beyond those types of things, and we need to look at trying to deal with allergies not just in your local community, but what's happening in the world and what's happening to our biochemistry that is allowing these numbers to escalate to such a tremendously high prevalence within the world. Obviously, in different parts of the world, there's also not very good support for that type of thing. So we obviously have to find things that you can do on your own without having to find a pharmacy for something that's over the counter generally. And we know that people living in poverty are seriously affected because it prevents them from working. But it's also, we need to be mindful that we always talk about hygiene. And we'll talk about that as we go along this evening, as to, is that the most prevalent thing? Yet if you go look in some third world countries where hygiene is probably not the top of the list, allergies are not as prevalent in some cases. So, but we'll try and expand upon that in a little bit. So we see that about 75 to 90 million Americans are afflicted by some type of allergies. And which is a good portion of the U.S. population of about 325 million as of last year, a few more probably. And we see that the typical types of allergic type conditions that generally people will talk about, and whether it's asthma or so-called hay fever, allergic rhinitis, chronic sinus infections, itchy eyes and eye problems and skin problems and food allergies, bee stings, mosquito bites, Lyme disease, is that an allergy or is it an infection? I mean, all these, and anaphylaxis, of course, is always a prevalence there. So what are your potential risks? Well, unfortunately, your first risk is your parents. and your grandparents and your great-grandparents, because we know that, genetics, there is a component of genetics, and genetics which is basically passed down, and hopefully you had an opportunity to view the one that we talked about last month on the immune system, and we see the prevalence of how much, what our parents hand down to us in the form of what we call our terrain, will have a huge impact. Epigenetics is also a huge role for those of you who are new to this, and that's a new term. We'll call it the modifiable components that affect our genes. We know we have just short of 24,000 genes in our body. We have upwards of over 100,000 proteins in our body, which means that one gene codes for multiple proteins. We therefore know that by changing our epigenetics, which means by changing our diet, by changing our lifestyle, by changing our movement, by changing our body biochemistry, we don't have to always have a reaction when we are exposed to something that is basically outside of us. So we know that there are also environmental factors that are having a component. You see all these things are having a component on that unborn baby, which is the ideal time, or even before conception would be the ideal time to deal with allergies as far as the infant is concerned. So early childhood will play a role, which is a whole other topic, how the development of what our children are exposed to, what happens as they grow up, and what precipitates their particular prevalence. Certainly what the children are fed, the type of air that they breathe will play a huge role in this whole allergy development, which happens during life. So as we've said, there is this genetic susceptibility for people, and if your parents smoked before you were conceived, or if your mother especially smoked when she was pregnant, alcohol plays a role, the environment, what she did when she was pregnant, the work environment she was in, all affect this genetic susceptibility. And then we have the allergic sensitization, which comes down to a whole variety of things that happens within childhood mostly. What type of infections did a child have? Were they immunized? Did they have vaccines? Which for some people, there is some suggestion that early vaccines and early allergy shots potentially later increase autoimmune disease. And then, of course, you eventually come to a point where there's a trigger, and there are lots of triggers, including good things like exercise. People are surprised that people can be allergic to exercise, and while it sounds funny, the reality is it can be very true. So we have we can have these single genes that basically, code for a specific type of condition. It is thought that the genetics of allergy are multifactorial. There's a number of things that are going on. Relates to something we talked about last month, which is immunoglobulin E, which has what's so-called is the allergy, or one of the allergy antibodies. So family history comes again to the term that we call terrain. What are you inheriting, or what have you inherited from the past several generations? So this hereditary tendency allows you, or increases the propensity that you may have the asthma, rhinitis, and eczema or dermatitis. And you see, it was Koch, who was a doctor back in the 20s, coined it as atopy. So having those three things, and they're very common. You may yourself have had those growing up, or your grandchildren may have those types of things. And often the atopic dermatitis or eczema starts on the creases of the elbow, or behind the ears, behind the knees, or some of the most common times. Often it's treated that's not, even though we don't talk about it, or often it's not talked about as being allergy. It's one of the first signs that allergy is underneath this. You only talk about put some hydrocortisone cream on, it goes away, stop the cream, and it comes back. And eventually, even if you keep doing that, it will go away and so-called stay away. But unfortunately, what ends up happening usually comes back as something worse, which could be asthma, or seasonal rhinitis, hay fever, sinusitis, those types of things. So this is a very common type of a picture. I'm not going to belabor that, but that just shows that we know that there is some genetic predisposition towards the potential that if you have allergies, that may be a factor. This is a fairly long laundry list of environmental components that we look at in the environment, and you start looking at these types of things and say, I'm doomed. There's nothing I can do. I mean, how do you get away from dust mites? How do you get away from breathing polluted air? How do we get away from consuming food that doesn't have some potential form of a parasite in it at times, et cetera, et cetera. However, these I believe are precipitating factors. So I do not believe that the mite is the problem. No more do I believe that ragweed is a problem. No more than juniper pollen is a problem. No more than eating gluten is a problem. It is definitely a problem, and they do create all kinds of allergy type symptoms. However, you still have to ask the question, well, why is the person reacting? So, and what about exercise? The person who does exercise starts to sweat. They develop hives all over there. They have welts, they itch, and they're very uncomfortable. You say, well, that's curious because movement is absolutely a necessity. It's a natural law that we need to do. What's wrong with doing it to the point of sweating, which is a natural detoxification process through your body? So these are all triggers, or precipitating triggers. We have to always go back a step before that to try and create an understanding. And I would say that's probably one of the ways biological medicine is trying to deal with these types of things, is acknowledging these triggers, trying to support that. And so if you're allergic to dust mites, let's say, it's important that you keep your living environment as clean as possible for obvious reasons. But more importantly, that's not the end of it. It's like, well, why am I allergic to dust mites? That's always the question we need to be thinking about. And we see that allergy is not new. It's you see how these terms were coined a very, very long time ago, to the point of 2100 BC. Anaphylaxis comes from Egypt. Asthma was a term used in Homer's Iliad, and Hippocrates talked about it 2400 BC. So it's over 4,000 years ago, there was some idea that something was going on. So it's not a new disease. This is not new. It wasn't obviously very as common as it is now because of things that have happened in the last couple hundred years. Rhinitis, you see, was a term that was found in old ancient books in 1533. And then, the word allergy comes from the Greek word, basically meaning altered reactions ability, coined in 1906. So the term is new, but the condition is centuries old for a very, very long time. So it's an ongoing challenge for sure. So by definition, you have an allergy if you react immunologically, which means the things we talked about last month when we look at immunoglobulins, the formation of antibodies, etc. So these allergic reactions could be either humoral or cell mediated. Once again, those are new terms, go back onto the BRMI .online/webinars and watch that particular webinar. So an allergen, take a drink, refers specifically to something that's a non-parasitic product that's capable of stimulating a type 1 hypersensitivity reaction, which once again we talked about last month. So these are just some common terms. Hypersensitivity and sensitivity can be synonyms for the term allergy, excuse me. The allergen is something that creates the IgE response. An atopy is a term, as I mentioned a minute ago, that basically talks about asthma, atopic dermatitis, or eczema, and rhinitis, and often we see that triad in many people. So, if you get exposed to these types of things, and of course, they're everyday things. I mean, it doesn't have to be poison ivy or poison oak. It doesn't have to be a cat scratch. It doesn't have to be, whatever the main pollen is in your area at this time of year. It doesn't have to be latex, latex gloves that unfortunately more and more nurses in hospitals and doctors and people who wear it are exposed to latex on an ongoing basis. Bee stings, why do probably a number of you listening this evening or watching the webinar later, get stung by a bee, and while it's not fun, it's uncomfortable and it's painful, like, why are we not in danger of dying from that, where there are other people who get a bee sting and they may have an anaphylactic reaction and die? So the allergen is a substance that causes a reaction when it comes in contact with the body, however it is, whether it touches the body, whether it inhales in the body, whether you eat it, it's in a food, et cetera, et cetera. So we have allergy due to a number of things. We've just mentioned these IgE antibodies, which is what we call the type 1 hypersensitivity. That's more commonly the asthma, eczema, and rhinitis. But also food allergies can do that. So the person who reacts to strawberries and their lips swell up, or a peanut and they potentially have a life-threatening reaction, or anaphylaxis that is a life-threatening reaction. But there's also allergy due to non-IgE mechanisms, which is more the type 3 hypersensitivity, which once again we talked about previously. And we also have allergy that's where we have sensitivity to a variety of different cells, specifically allergic contact dermatitis. So that's somebody wears a ring, you take the ring off and you see, where the ring was, it's that they're having some type of a reaction. So those are all different possibilities. So this hypersensitivity, sensitivity, it's basically, once again, it could be immunologic or it could be not immunologic. There's something that's inappropriate about the response. That really is what is the key component of what it is that we're looking at here in, at this point in time. So these hypersensitivity reactions, of which we have these 4 types, they're basically based on the mechanism that is underlying that. And some conditions are more than one mechanism, which obviously makes it a little more challenging. I'm not going to go, we did this slide or one similar to that last month, because these are the 4 types of hypersensitivity, type 1, 2, 3, and 4. And depending on what, the reaction is, we have different conditions, different types of problems. But, the point of this evening is not to belabor that. It's just to tell you that allergies can be a rather complicated component that is looked at, and it's much more complicated than just thinking about, oh, I don't know, you just take an antihistamine, because like Benadryl, which has been around forever, because it definitely helps people, get through their allergy issues. So this is the type 1. This is a common one that I suspect a number of you this evening will have, especially this time of year. This is but you can have reactions, once again, I said, throughout the body. Could be on the skin, hives. So you get exposed to something, or you don't even know what it is, and 20 minutes later, you have hives all over your body. Or the redness of the eyes, the swelling of the eyes, discharge out of the eyes, the runny nose, congestion, sore throat, postnasal drip, asthma in the lungs, or gastrointestinal distress. So all these type of reactions typically happen relatively quickly, usually within half an hour of the exposure to the antigen, which is the foreign substance that's causing this reaction. And as we said a minute ago, these are mediated by immunoglobulin IgE. And typically they involve these cells called mast cells, can also involve basophils. But when you get the exposure to the allergen, you see the little in the bottom corner down here, the antibody, which is the IgE, attaching the allergen to the mast cells. It causes this mast cell to degranulate, which is like all these black things in the cell. You see all the release of these compounds, histamine. Histamine, we know about antihistamines. This is typically found in certain types of cells, and depending on which part of the body is involved is when you end up getting these types of reactions. And so we already talked about whether it's the lung or the nose, the eyes, the skin, the GI tract, or unfortunately, a systemic reaction, which is potentially threatening. So those are all clinical potential presentations that somebody would have. In this IgE mediated type 1, we have this overreaction, once again, to the allergen that we basically have been mentioning. Atopy, just to go back there, that last point of the allergic rhinitis, runny nose, stuffiness, that you can't think, headache, ice, sometimes to the point of swollen. Sometimes you're aware of the postnasal drip. You're running, you're basically blowing your nose all the time. Those are certainly the most common manifestation, of somebody who is atopy. Allergic gastroenteropathy is rarer than what we've just described in general. And in fact, atopy can even be totally asymptomatic in some people. Just another, showing the research that we now know in the last 15 years, which was unknown before 2003 or so, but we know that it's been around for a long time. And these are the laundry list. A laundry list of some of the more common type foods or exposures, environmental, that people have, and whether it's a protein, whether it's a pollen, whether it's a medication. Penicillin, of course, has been around, probably one of the oldest medications, been around since the late 40s, early 50s. So lots of people have had potential lots of time to eventually have been exposed to that. But then you have insects, you have mold, you have a variety of foods, all very, very common. So what's happening? So, how does a baby have an allergy? Well, at some point there was an exposure. Now in a baby, that exposure may have happened in utero, even before the baby was born, because we've seen babies who've been born with eczema. They're already having some redness in their elbows, and that's because mom was in we'll call it a particular stressful state. All the excess histamines were circulating in her body, or the allergens were circulating in her body. The baby got exposed to that, and it became sensitized, and then further exposures eventually is what leads to the outward manifestation. Typically in type 1 exposures happens relatively quickly. In rare cases, it may occur on a more delayed type thing. But these mast cells, these basophils, once again, the ones that we talked about in the previous work, in the previous webinar last month, are what we need to be mindful of. And you hear now of conditions called mast cells, mastocytosis, an inflammation or an irritation, because mast cells degranulate all the time, creates a whole host of problems. These granules that I showed in that previous slide, so what's in there? It's not just histamines in there, because when the mast cell is activated by the antibody antigen reaction, as you see in that picture, so you see the little Y, which is the immunoglobulin E, and then the yellow square is representing the antigen, which can be anything that's an antigen, causes a release. And these are the compounds. And so the symptoms you experience are due to the release of these compounds. And antihistamine will not be a new word, because virtually everybody with any type of an allergy knows about antihistamines. So it's only one, however, of the well-known mediators. There are certainly other mediators that are possible, but it's certainly one of the more common ones. And that's, of course, what led eventually to, how do we treat allergy, or how is it, I won't even say treated, how is it supported? Because I don't think antihistamines is really a treatment for allergies. It's a band-aid so that you can live that particular day and are not so uncomfortable. So these mediators, this release of histamines or bradykinins or prostaglandins, have an effect on some tissue, often mucous membranes. So why is the nose involved? Well, we inhale it. Or why is the lung involved? We breathe it in. That's the area we get it in. Technically, if you're eating some foods, you could have pollens on them, and you could get some GI distress, although the hydrochloric acid in your stomach ideally would break that down so that you wouldn't have. That's why it's not as common to be within the digestive tract, because we have the protective barrier from the hydrochloric acid specifically. So there are specific type receptors called histamine H1 and H2 receptors, and there are medications, of course, that are focused on H1 or H2 that causes, once again, the manifestation of the symptoms that we can perceive to be uncomfortable. Another product that gets released is called tryptase. It's a protease, which means it's a protein-like substance. It's released by these mast cells again. We don't really know what it does, but biochemically, it's doing things that are not particularly comfortable to the individual. We have proteoglycans, we have chemotactic factors. So all these types of things, from a biochemistry perspective, is part of this picture. And once again, my point of this is not to belabor it, just to realize that this is not as simple as give me some over-the-counter antihistamine, or whether you do it from a prescription perspective, or whether you see a naturopath who says, take quercetin, take aspirin, use vitamin C, which are all great things to do. However, they still don't deal with their triggers. They support the trigger, but they don't support the problem. That's really what we're going to end up talking about it if we look at it from a biological medicine perspective. So you see mast cells are involved in lots of different conditions. Interstitial cystitis, chronic prostatitis, asthma, allergy, migraine headaches. I mentioned systemic mastocytosis. We have a couple of patients presently who were just in the clinic recently with that particular, and it's not comfortable, to say the least, because it's affecting so many cells of the body, and it's trying to be managed by stopping the reaction. We say try to stop degranulation of the mast cells, so you don't get all these particles released, ideally to minimize the symptom. But you have to still say, but why are we sensitive? So these are just, just another representation of this mast cell activation through through granular release. And where is it affecting the GI, the airway, blood vessels? It's a systemic condition that affects all over the body. So just a note about basophils, which are another cell that can be involved in this. You see also that we have granules in that particular cell, and when they degranulate, we have histamines released, which, as you see, it increases vascular permeability, which means things leak out, we flush, we get red, causes the smooth muscle to constrict, which by itself causes some distress. And then we see interleukin 4, interleukin 13, or IL-4, IL-13, which promotes more IgE production. So it's this vicious circle. So we have these biochemical aspects. Eosinophils are the so-called things that people with allergies are not happy about. So if one has allergic rhinitis and we were to do a nasal swab, look under the microscope, typically we'd see that there's a lot of eosinophils. Sorry, somebody come to the door and it's like, oh, God, my dogs are barking. So these eosinophils are a component of, they hold on to the granules for what's going on, and they create these pro-inflammatory mediators, which creates the uncomfortableness of the symptoms. So how do we diagnose that? Anybody who's had allergies, who's been to the allergist, has done the pin pricks, the type 1 hypersensitivity, where you prick the skin, you put the allergen in contact with the skin, and then you sit and watch to see whether or not we get a reaction, from that particular aspect of things. So moving away from the type 1, we look at the type 2 hypersensitivity, which we call cytotoxic hypersensitivity. And that can affect a variety of different organs, a variety of different tissues. These antigens are normally endogenous outside of the body, but internal chemicals, and the exogenous ones, can be a component related to that. These are pretty serious conditions. Thrombocytopenia is platelets being destroyed. Drug-induced hemolytic anemia is pretty serious too, because your red blood cells are being destroyed. So these are these are all just other forms, we'll say, of hypersensitivity. You know, we have these here. We see IgM, which and IgG. We had talked about IgE previously. We tend to see these types of things. You see that little diagram in the bottom. In the early stages, we see a rise in the IgM, later followed by a rise in the later stages of IgG. So, you know, the whole point of this isn't to be so technical that it's like we are lost, you know, with, you know, in the forest when we're looking at the trees. But one of the things you may be familiar with is any of you who have babies, where you have an Rh incompatibility factor. This is the type of thing that ends up happening. So you have an Rh positive father, you have an Rh negative mother. So you know, there's an incompatibility there. So in response, so then the baby, you know, basically can start producing, you know, if the baby is Rh positive, starts producing antibodies against the mother. So of course, this is when the mother would require a RhoGAM shot, because in the future, if she was to get pregnant, it could cause catastrophic problems for the next baby. We also have type 3, which is these immune complex hypersensitivity reaction. You know, it can involve the skin. Lupus is unfortunately increasingly common type problems. Kidney problems, lung problems, aspergillosis, blood vessels where you have multiple inflammations within the multiple arteries called polyarteritis, rheumatoid arthritis. You know, it's like, oh, do we think of rheumatoid arthritis as an allergy? We certainly think of it as an immune problem. So there's all these types of problems that are going on. And once again, we discussed those more in detail last time. So again, if you want more detailed information, please review that from the website as we go forward. This type 3 complex said these, you know, if you were all physicians and we wanted to do it more in detail biochemically, but that's not what we need to focus on. Then we have, of course, the fourth type, which is cell mediated or delayed type hypersensitivity reaction. We don't use this as much anymore, but in the past, depending on what your occupation is, you may have been asked to do, or if you were exposed to somebody with tuberculosis, you may have been asked to do a tuberculosis test where they basically inject under the skin, you know, a little bit of the antigen, and then you wait, and you know, you look at it between 48 and 72 hours, and if you get a big wheel of the sensitivity, it means you've been exposed to that particular, you know, problem. If there's nothing, then you haven't been exposed. So there's a different type of tuberculosis test now that's more commonly done, but I'm sure the tuberculin test can be done. This is one that some of you may have already experienced, the exposure to poison ivy or the exposure to latex gloves, where, you know, you get exposed. It's the incredibly itchy, vesicular, does not feel very good. You know, you try and stay away from it, but almost often by the time somebody has it, they've spread it to somewhere else in general. So, bit of an overview. We've been talking about the whole idea of atopy. This whole idea of IgE mediated or non-IgE mediated. This is what people generally think about when we talk about allergies, is that type of thing, which is the seasonal rhinitis, or in some cases perennial rhinitis, where it's on an ongoing issue. So these allergic reactions can occur, once again, in any part of the body. They're not limited to the head area, although they're certainly among the ones that are more common, because they can be upper, lower, can be in the vascular system, can be in the digestive system, it can be on the skin, or it can be life-threatening overall. So we have this allergic rhinitis, which are these pretty pictures, and I found that picture and I said, isn't that appropriate? Where this poor young lady would, you know, this constant drippy nose. You know, it's like you can't use enough Kleenex. So he said, I'll just walk around with the toilet paper and I'll always have it. So what you're looking at there is sort of inside. When you look inside the nose, we have this redness and this inflammation, which is what allergic rhinitis is all about. It's unfortunately very common. Hay fever is the other type of thing, although what's important to know, it doesn't have to be hay. that causes it. But obviously, when they started talking about it, but you know, this term has been coined back in the 1500s, so it's been around for a long time that people have noticed this type of thing, because there are certainly other things that can trigger it. You know, pretty much any airborne allergen, which is any pollen or dust or mold or anything that gets blown around, has the potential of irritating and causing that type of thing. One of the unfortunate things about allergic rhinitis is about half the people who have it may develop asthma, especially if it's in children. There's a high likelihood. So this is the most common clinical expression of atopic hypersensitivity, which I've mentioned. The allergic asthma is the same type thing, and asthma, of course, is this constriction of the lungs. So people have great difficulty. They wheeze. It's hard to get air, you know, to properly oxygenate the air. They can be in severe distress, and in fact, there's a condition where even with medication, the asthma attack won't stop, and unfortunately, every year there'll be people who will die at this time of year from you know, intractable asthma, and it doesn't stop. So it is a chronic inflammation with the, you know, within the airways that is creating this stuff, and so this wheezing and breathlessness and easily out of breath, and it feels like somebody's sitting on your chest, or they're coughing. And in children, it's the asthma is more often coughing than it is wheezing. As children get older and into adults, it's more that the tightness of constriction. But a child, you know, who may just be coughing, the parents may just think, oh, they must just have a virus or a cold because they're coughing a lot. But in fact, that's quite a common presentation in the young babies as their form of asthma. So the episodes are associated, you know, with widespread but some variable aspect of airway obstruction. That's certainly a problem. You know, you'd have to be living under a rock to never have witnessed or seen young children, or even adults for that matter, who don't have an inflammatory disease of the skin known as atopic dermatitis or allergic asthma. In young children, typically, other than on the rare occasion even from birth, but more often it's usually starts about 6 months of age or so, and usually associated in many people with solid foods. If mom has a history of allergies herself and is well aware and has been counseled during her pregnancy that she should minimize potential exposures to any of her known allergens at the time. We don't have time to treat them when she's carrying the baby, but you know, the ideal time would be to treat it beforehand. So mom would have to be less concerned about potentially of passing on these allergies to her child. So this is a term you probably have heard about. It is life-threatening. In fact, it's likely that some of you may know somebody, as obviously as a physician. Fortunately, I've had patients who've died of anaphylaxis. It's very tragic. These are the people who carry EpiPens around, and of course, EpiPens made all the news in the spring or last fall when they doubled or quadrupled the price of the EpiPen, much to the chagrin of people that this is life-saving for them if they get into a situation where they get all this constriction and pretty much anything in a highly susceptible person that could cause an anaphylactic reaction. It is a sensitization, once again, of IgE, and then the subsequent exposures, and whether it's cigarette smoke or pet dander or a peanut or, you know, whatever, you get a whole host of symptoms: hives, itching, color change, tingling, nausea, diarrhea, coughing, swelling, difficulty breathing, clammy skin, panic attack, dizziness, loss of consciousness. Now, all these, of course, are not just associated with anaphylaxis. All these, as you see, I've starred them, can be associated with lots of other things, not just anaphylaxis. The most important thing is it has to be recognized, because anaphylaxis can be fatal within minutes if not recognized and if not treated properly and efficiently. They usually begin, and so if anybody's had allergy shots, you're well aware that after you've had the allergy shot, they don't just you can go out the door now. You have to stay hanging around for a while, because usually within 15 or 20 minutes, if you're going to react, you're going to react. It doesn't mean the next day you couldn't. it's possible, but it's so much less likely. So we have these biphasic reactions that are totally potentially dangerous. Maybe a very mild initial symptoms, and it's like, oh, I'm fine, not a problem, doesn't get treated, and then this so-called false sense of security, and then the person ends up having a fatality from the actual reaction to the. And these are your typical ones: bee stings, latex. Unfortunately, has become more and more common. It's pretty serious when you think exercise can cause a life-threatening problem, but it certainly can. So here's your most common ones. And I suspect the number of you listening, yep, you can identify with these types of things. But by no means are these the end-all be-all. There are other things that potentially are a problem. Latex is becoming more of a problem, as I mentioned earlier. It's often among medical personnel, people who are putting on and taking off latex gloves on an ongoing basis as they go from patient to patient, as they go from procedure to procedure. Sometimes the manifestation can be straight contact dermatitis. So you have to wear 50 pairs of latex gloves during the day. Now, thankfully, they have non-latex gloves, so that's obviously what people are pushing more towards because of the fact that it has the potential of pretty devastating and potentially life-threatening anaphylactic reactions for people. It is now being more recognized. It can be as fatal as I said. People with chronic urologic problems in spina bifida statistically, for whatever reason, have been found to be more sensitive. And you obviously have to use non-latex gloves and catheters for patients who have any type of sensitivity. The natural latex is found in these very commonly occurring substances, including surgical gloves, which once again is in the medical field. You go to the dentist, they put a rubber dam on your tooth before they do some type of a restoration. That could be a problem. Obviously, latex condoms would be a problem. Erasers, we don't think about it, or balloons. We go to these parties with balloons. The backing of carpet can have latex in it. Band-aids can have latex in it. So, somebody puts a Band-aid on something and gets red, hot, swollen, and they think, oh my God, the infection is spreading, I got cellulitis. They may actually be reacting to latex that's in the Band-aid. Synthetic latex, on the other hand, does not create this type of reaction. Wasps, hornets, and bees, nobody wants to get stung. They're dang uncomfortable, and we always know that they sort of end up somehow, up your sleeve or down your blouse or shirt or up your pant leg, and you're hopping around because the bee can't get out, and you may get stung 2 or 3 times. I had a patient just last week basically was stung on the cheek and was stung and was sort of going around. You're not looking at it, and got stung more than once and a pretty significant swelling for a good period of time. They can be life-threatening, these insect bee stings. But let's not forget about the whole idea of food, which is one that can be a challenge, first of all, to find out, and even more of a challenge if you do find out, what am I going to do about it? Because short of eating whole food where you look at the food and say, this is a cauliflower, this is broccoli, this is whatever, I know what's in there, but as soon as you say it's flour, like, what's in there? Who knows? All kinds of things could be in there. So we have these, once again, these biological type 1, type 2 type of reactions that people have. Food sensitivity can cause the same myriad of symptoms that we just talked about with environmental type products. So the rhinitis type stuff could easily be a food. People think, oh, the juniper pollen is high, or the beech pollen is high, or ragweed is high, etc. So foods, and we'll see in a sec, foods and pollens have cross-reactivity, and they're important to pay attention to because often in allergy season, people will find that they're more and more sensitive. Alternatively, some women during their menstrual cycle will also find that they're more and more sensitive. Because when the immune system, when our multiple other organ systems are, playing in balance, they're trying to be in balance, they don't have as much support, and you may then manifest in the form of a symptom. These are our most common food allergies. We're saying 5 to 6% of the pediatric population, which doesn't sound high, but this is a true allergy. There's many more percentage of children who have a sensitivity, more so than an allergen. And so they may not manifest the same, but they may have failure to thrive. They may just not feel well. They may be moody all the time. So peanut, shellfish, fish, tree nuts, eggs, milk, soy, and wheat make up 90% of the food allergens. Of course, if you take all those foods out of the diet, people say, there ain't any left. So those, with the exception of nuts, of course, all those other things, eggs are in lots of things, milk is in lots of things, soy, excuse me, is a very common additive. So people tend to think that there's no cure for food allergies, and the only thing you can do is strictly avoid. Well, that actually is not true, because biological medicine would definitely disagree with that. So it's true that, in fact, even an allergist told me 30 years ago that even a child who may have had an anaphylactic reaction to a peanut or shellfish or something doesn't mean that they're always destined to have that severe anaphylactic type reaction. So we can strengthen the body, and that, of course, is what biological medicine is trying to do. Here's your top 8 allergens again. And food allergens, like environmental allergens, can cause a reaction anywhere in the body. Food allergens do not have to have symptoms limited to specifically the digestive tract. Yes, it may cause diarrhea. Yes, it may cause malabsorption, maldigestion. It may cause ulcers. It may cause heartburn. It may cause constipation. They can cause anything. However, they can also cause palpitations and insomnia and hives and atopic dermatitis, which they commonly do, because they do and can stimulate, once again, these release of histamines. So we now have people doing low histamine diets, where it's a very strict list of foods that are low in histamines, because the histamine themselves are triggering more and more symptoms for these people. The reaction can be minutes, in some cases hours, to the next meal, to the next day, for some people over time. Now, it's also important that we think about the fact that there's some, these IgE on the mast cells can trigger, once again, these symptoms pretty much anywhere in the body. And it's also possible that it can create intestinal permeability. Leaky gut is another term that you may be familiar with, where you have increased sensitivity of the mucous membranes, and so the allergen now is in your bloodstream, and now it doesn't stay in your GI tract, and that's how it gets to every other organ. And that's how food can cause an allergic reaction and resulting in asthma. So there's many studies that have shown that food, and it's not the only one, but dairy is a common one. There are many, but any food could do anything in a susceptible individual. So that's what we have to be mindful of. So there's also many other, in addition to food allergy, which we could say is an IgE reaction. There's so many more people, or there's also IgG reactions. There's so many more people who have problems related to just straight food sensitivity. It may be an enzyme issue, or people who have lactose intolerance. Lactose is the milk sugar, and people will say, well, I tried lactate, but I still didn't tolerate it. It's probably not the well, it isn't the lactose. It would be more likely the lactoalbumin or the casein, which are milk proteins, and you're reacting to the protein. And for most intents and purposes, that's what immunoglobulins glom onto, are proteins. They don't so much glom onto fat, but it's the protein aspect of what they attach to. So once again, here, that's what I basically just said. It's an immunologic response to the food protein. And you can get mild hives to severe anaphylaxis, which is, of course, may end up in the person passing away, unfortunately. So an actual food allergy is a problem. People will confuse it with a lack of digestive enzymes for different reasons, because you end up, if you do tests, so people will say, oh, I can't eat watermelon, let's say. You do an actual test, and watermelon doesn't come up. And they say, well, this test isn't accurate because I know I can't eat watermelon. Well, it may not be a food allergy. It may be that you don't have the enzymes necessary to digest that food that you think is causing the problem. So that's why this can be a rather complex, uh, bag of worms, we'll say, to try and figure out. And it's not as simple as take this medication. There's so much more involved. Here's a fairly lengthy list of many of great variety of different types of problems that patients will present with or can present with, but are often not assumed immediately to be an allergen because they're not having the runny nose and your typical they don't get hives. However, every one of the issues that are listed there, which are every one of them is very common, including if you look at the cerebral ones, the so-called foggy thinking or irritability or depression. We often associate that with being depressed, obviously. However, it's like, you take the foods out, and suddenly they say, well, I didn't change anything other than I don't eat food X, Y, and Z, and my mood is so much better. How's that possible? Well, because they were having a reaction to a food or foods, and that's how the body was manifesting its specific symptom. But once again, many types of problems, which is just a different way of looking at that last list, which is trying to divide them up into whether it's in the respiratory tree, whether it's on the skin itself, whether it's the behavior change, the temper tantrum in a little kid, or a migraine headache in the teenager, or irritability premenstrually. We always want to associate it with the specific, but we have to look at the bigger picture. And allergy is certainly a component that needs to be not taken for granted in general. And the reason we know that is many of these food reactions do not involve IgE at all. So they're not the standard immunoglobulin. So they're more intolerances. And it's like for different reasons you can't tolerate it. But 95% of IgG, once again, different antibody, are not fixed. Therefore, when you avoid the foods, the problem foods can be reintroduced and you're fine. And that's obviously what our goal is. So we see this is a common list, and that slide is probably a little too small for you to read, but it basically talks about neurologic, respiratory, circulatory, GI, joint, musculoskeletal, skin, and a variety of other symptoms. So there's not a whole lot of reasons that people show up to the doctor that you can at least consider, is allergy a part of my problem? And it may be. But once again, there's 75 to 90 million Americans who have it, which means there's 250 million who don't have it. So why do those have it and those don't? It's not just about the actual manifestation. I think this is an important slide. It's a little blurrier than I would like, but here it is. There's a cross reaction. The immune system gets confused. And so if you're exposed to ragweed, let's say, then you may eat watermelon and say I react. And that's people say I react to water. So watermelon, what's in watermelon? It's like 80% water. There's some seeds and there's some red fiber, I'll call it. How can you be allergic to watermelon? Well, actually maybe a cross reactivity to a sensitivity to ragweed, which may or may not be high at the moment you're eating the watermelon, although obviously in the spring and summer, they tend to be, both raising at the same time. Watermelons are growing, and pollens, different types of pollens, are also increasing. So if when somebody has an allergic reaction and they say, well, I didn't eat anything different, I don't know why I'm reacting to whatever, because it may simply because it's this cross reactivity from some environmental source that actually is the trigger, and then eating the food that has a similar biochemical makeup as far as the biochemistry is concerned, is a real issue. So we see latex. It's very common that people with latex sensitivity don't tolerate bananas. And you'll say, "Would you eat them?" They said, "No." Why don't you eat them? I don't like them. Because somewhere along the line, in many cases, their brain said intuitively, "Don't eat that banana. It's not good for you." Now, does that mean you can never eat bananas? No, once again, not at all, because that's not how biological medicine thinks about it. I said this one is one of the more unpleasant ones for people. Strenuous exercise, which means, I can never do strenuous exercise. Well, not initially, not until we try and see if we can sort out the problem as to why exercise even is the problem. Often exercise-induced anaphylaxis occurs around the fact that they've recently eaten something that they didn't realize was a problem. They may have been given a certain medication. They may be starting a new medication. The weather may change. They may be menstruating. Women tend to be more affected, unfortunately, than men, and they may be having other allergy symptoms also. So the whole idea with people who have this is that they shouldn't be eating at least 4 hours before they do some form of exercise. This, of course, is the most frustrating one. In fact, one dermatologist told me one day that 80% of most of hives and things, have a hope of figuring out, because there's so many factors, there's so many components involved. It's like, okay, so instead of worrying about what was it, which is the conversation I had with a patient today, we need to basically build up the person so that they don't react so aggressively and so strong. So we've been talking about immunoglobulin mediated. This is a non-immune mediator, non-IgE in this case. Hypersensitivity pneumonitis involves in breathing in, getting it into your lung, and you get this exaggerated immune response that creates pretty significant distress for the person over time. So how do we diagnose it? Obviously, talking to the person. What have they known from their previous reactions? Standard has been skin testing and blood testing. Not what that's not what obviously I do, because we are equipped to look at other types of things. So we can do skin tests, we can do blood tests. Once again, if any of you have actually had a standard allergy test, they inject a substance under the skin. And it's curious, here's histamine way down in here, and histamine is showing a bit of a wheel there. It's like, wow, you're allergic to the thing that, so this is your control reaction. You should react, obviously. And now you see feathers and cats and dogs and horse, the person all reacted to. Birch pollen, grass pollen, daisy, the mold they didn't react to, sheep wool they didn't react to. So that's how the allergist decides this is what the problem is. So in addition to doing a scratch test, you can do an intradermal test. This is basically how the old tuberculosis test used to be done, where you have this intradermal, underneath the skin. That certainly doesn't look very comfortable, where you have all those red responses. That back would be very sensitive, itchy, probably. Another way is to basically, if you don't know what it is, you take the allergen and you just tape it on your forearm or somewhere and look at it in 24 to 72 hours. Those types of things typically are responsible in contact dermatitis. There are some blood tests that are done, not standardly by conventional medicine, but certainly by biological medicine. We think that they add a piece to this puzzle. Tryptase is something that could be measured to give you a clue whether or not you're getting all this degranulation of things that are going on. The standard allergy tests basically are looking at antibodies, which we have talked about last time and this time. And when you do a complete blood count, you may see elevated eosinophils, which is one of the 5 red blood cells that we previously had spoke about. And when eosinophils are really high, as they would be, let's say, in allergic asthma, or in somebody who has an miss of a full-blown allergy attack, you would expect your eosinophils to be quite high. You could do a nasal swab and see those eosinophils under the microscope, as I mentioned previously. You can measure IgE levels. The RAS test is a blood test specifically to look for food sensitivities. We can also do a food allergy test. We can do a coca test by putting your 2 fingers over the pulse. That's applied kinesiology. So people have a variety of different tools to be able to do that. That's the nasal smear, that I mentioned a few minutes ago, where you try and gather, whatever in there, and basically you can either culture it if you think it's bacterial, or you can actually look under the microscope. There's also spirometry test for people who are having some issues. So biological medicine-wise, allergy is really no different than any other condition that we see and treat. It's not about the allergies. In fact, we could say we don't treat allergies. We can support you if you have them, but we don't treat them because it's not the real reason. Once again, they're only the trigger, and people have a very difficult time appreciating and understanding that why are my allergies still so bad? Once again, we're not specifically treating your allergies. We're trying to help you understand the reason you have it, and there's potentially many of them. So when all our organ systems are in balance, surprise, there's no allergies. So that's the key. So if somebody is having an allergy, has allergies, and you see them sneezing or red eyes or whatever the symptom is, you can pretty much be assured that all the systems that are listed on that page are not doing okay. There's something that's out of balance. Your job, find it, make a change, see what you can do about it. So this is and by definition, again, allergy is this continuous imbalance in one or more systems. Not part of this discussion is chronic disease, because I consider allergies a chronic disease. Call it the 5 T's: terrain, toxicity, thoughts, teeth, and therapies. Obviously, that is a 2 or 3 day seminar to talk about each of those individual components. In fact, in some cases, maybe longer than that. So what does biological medicine do as far as testing is concerned? We're looking at multiple things. Once again, it's not so much what are you allergic to, which you may or may not know. We may or may not attempt to specifically find it. We just know that what you're describing is very typical of allergy. So we can do a bioimpedance analysis, and gives us a couple of important pieces of the puzzle as far as how your body composition is, arranged. So a woman is ideally about 55% water, which is, it's not just her lower extremities, but it has a great deal to do with it. A man, on the other hand, should be about 60% hydrated. And this water, where should the water be? The water should be inside your cells, not outside the cell. So intracellular water should outpace extracellular water. Makes up the bulk of our bodies. We have some fat, we have some proteins, lots of proteins, some carbs, etc., that make up a smaller portion of our overall body. So, as I just mentioned these statistics here, babies, however, are literally a water balloon. They're like almost 80% water in some cases, which is like, you have this fluffy, soft, touch the skin, they coo, they sleep, they smile, 75 to 80% water. But it drops to, by 1 year to 65%. And then as we move into adult, it'll drop even more. So it depends on fitness, it depends on gender, 60% for the man, 55% for the woman. Overweight men and women have more water than their leaner counterparts in general. Important component is this whole idea of dehydration. If people are waiting till they're thirsty, they're already dehydrated, because thirst is a sign of dehydration. You should never, for all intents and purposes, we should never be thirsty. Never be thirsty, meaning you're drinking water all day long. The first sign of dehydration, interestingly, is a decreased mental performance. So if you have trouble with brain fog or staying focused or concentration and all that type of thing, we need to be mindful that this may simply be dehydration. And whether it's a hot day like it is in Arizona, or somewhere wherever you're listening to this from, where you're at, we need to be constantly drinking water on an ongoing basis, to see how things are going in general, and so that we don't get that. And then this total body composition, basically it shows, as I have shown on this slide, it shows your lean body mass, it shows your body fat mass, it shows your total body water, it shows what's inside the cell, it shows what's outside the cell, it also shows your percent body fat, and it shows your muscle mass. It's a very valuable piece of information. So what does that have to do with allergies? Everything, all these pieces are like one piece of the bigger puzzle. So we put them all together so that we can try and understand why indeed you have allergens. The straight aspect of this can straight show dehydration. You say, but I'm not thirsty and I don't feel dehydrated. That's not what the internal cells are telling us. Internal cells are saying you have more water outside your cells than inside your body. Heart rate variability, incredibly valuable and important tool when you're looking at the picture of allergies and sensitivities. Because what your nervous system is doing plays an incredibly important role with what all your other organ systems are doing. So we have the flight-fright aspect, the sympathetic nervous system, or we have the rest, relax, calm, digest aspect, which is the parasympathetic aspect of the nervous system. And we need to find the right balance. So often I find people who have allergies that basically spend more time on the right side, which is the sympathetic division of the nervous system, versus on the left side of the picture, that is basically parasympathetic. So parasympathetic, rest and relax, and most important, one of the most important aspects you see, it says it stimulates the stomach, the pancreas, and the intestines, while the sympathetic dominant state inhibits the stomach, pancreas, and intestines. So if you're eating food in a sympathetic dominant state, you're going to be more susceptible to having a reaction to it because the body is not well equipped to be able to break those things down. And that's obviously a problem. Here's the yin and the yang, parasympathetic up, sympathetic down, flight, fright, rest and relax way of looking at that. And then the report that we get basically looks most specifically, there's a variety of things, but it's near the bottom where you see those two triangles. The first one, the rose-colored one, is sympathetic, and then the light blue, purple, if you like, light purple, is parasympathetic. Now, that's showing 100% for the sympathetic and probably 90% for the parasympathetic. The actual ratio should be 60 sympathetic, 40 parasympathetic. This is obviously out of balance. This person is going to have some issues with a whole variety of things. CRT, contact regulation thermography, measuring 119 points, 15 different organ systems, glands and tissues, etc. Gives us a look at how our body responds when it's under stress. And these are the 119 points that get checked. Then we get a graph that looks like that, and we can interpret the graph. This is what a normal graph should look like. I don't have one here. So we have two readings. The black bar is the first reading, the red bar is the second reading, because how we do the test. You test the points, you sit in a cold room for 10 minutes or so, and then we come back and retest, which puts a stress on the body, which then we read by the red. And you see all the red ones are a little bit longer than the black ones. That's the way it's supposed to be. That's a normal reaction. Unfortunately, people with allergies, that's not what you're going to see. So we're going to see multiple areas of the body that are out of balance, which is obviously contributing to what the body is doing. Zeta scans measure different organs. We can look at the different organs. Adrenal gland is one that's often associated with allergens, an allergy. in this case, it's hyperstimulated. We would need to do things to try and calm them down, as it is with the other organ systems. One that people may not be as familiar with, but is absolutely critical and essential, that everybody with an allergy must support their liver, because the liver is your filter. The liver is what looks at this stuff and says, "What is that? I don't know what that's. Is that a piece of food that because of leaky gut that shouldn't have got through the gut lining, or is that a mold that somehow got in here that's into the bloodstream that shouldn't be there?" So I'd say this is probably the most undertreated organ when somebody has allergies, but it should be the first treatment. So we're talking like things like castor oil pack. We're talking things like dry skin brushing. We're talking things like eating liver foods, taking nutraceuticals that will support all these phase 1, phase 2 reactions that happen in the liver. It's so critical. I mentioned earlier that what you get from your parents is what we call the terrain, made up of 3 parts: this miasm, the temperament, and the constitution. The names beside the constitution are all homeopathic remedies, and almost without exception, every single person listening today is one of those 7 homeopathic remedies when you truly get down to your core. Miasm is how you react in certain situations when you're exposed to something foreign, and temperament is how you react on a day-to-day basis. So the balancing of all these areas really becomes the critical point. So the conventional treatment is to avoid it, take medications, do some education. Perhaps you may use some immunotherapy. In an emergency situation, I mentioned the EpiPen that people carry around that's life-saving. Fortunately, they doubled the price, for a single, and these things expire. They're not good forever. It's like you can't just be carrying it around for 3 years hoping you never react. There's a pretty rapid turnover in just a few months, and you have to constantly keep it updated if it's going to prove effective. There are pros and cons to allergy shots. Obviously, patients who come to see me or a naturopath in many cases may have already done allergy shots. And my mentor, Dr. Lendon Smith, from many, many years ago, if you're old enough to remember, Dr. Smith was a pediatrician. He wrote something like 18 different books on pediatrics in his day. He passed away 5 or 6 years ago. He was about 85 years old. He was a wonderful man, and he often said to me, you have about a 40% chance that this is going to make it worse. You have about a 40% chance you may make it better, and a 20% chance you won't do much anything. So 60 to 40. It's worse or nothing or better. Some people will do allergy shots for 10 or 15 years, and believe me, if they haven't been helping in that length of time, they're not going to be helping, and we're totally treating the wrong things. And this is just a slide. You can look at it and say there are some things that are pros. Obviously, there are some things that are cons. So pros and cons to doing anything is the challenge. I prefer to think that we have other ways of dealing with it. When we look at the conventional medications, they target different areas, whether it's an antihistamine, whether it's a corticosteroid, whether it's a mast cell stabilizer, or a leukotriene inhibitor, or something that's nasal anticholinergic, or decongestants that people take, or immune modulators. These are all sort of the standard approach. These are many of the common over-the-counter and prescription medications. Once again, they don't deal with the problem. They only cover up the problem. And yes, they will buy you time. Yes, in the middle of allergy season, you may have to do that, but the goal is you then see a naturopath or somebody who basically has the ability to go beyond just treating your symptoms and using diagnostic tests, trying to find out what your nervous system is doing, what your cardiovascular system is doing, what your digestive system is doing, where is your body water? Is it in the right place? All those types of things. Some of you may have heard me speak previously, and you're aware of what we call natural laws or the basic treatment guidelines. So to me, these become part of all allergy therapies that people do, including getting outside, here in Arizona, that means early in the day or later in the day. It gets a little warm during the day. Doing something fun every day, taking deep breaths. And this is all about balancing all these systems and getting all your organ systems to work in balance. Because as I showed you previously in that one slide, when all your systems are in balance, allergies are really not going to be a big issue. Diet is an issue that you need to discuss with your particular practitioner about what they think is best for you. We know that hydrotherapy is important. We know sleep hygiene is important. These are some just general eating suggestions for everybody, allergy or otherwise. I like apple cider vinegar because it helps sort of start that process of starting the digestive process. As the smell of food cooking, think about the food that you're going to eat, chew it often, put your fork down between meals. Don't drink when you're eating because that tends to dilute your hydrochloric acid and your digestive enzymes. Certainly never drink anything cold because you definitely will impede your ability to digest things. Give thanks, eat in a peaceful situation, and after eating, try and relax for 10 or 15 minutes. Allergy or otherwise, we now know that the greater the variety of foods that you eat, particularly the greater the variety of colors of foods that you eat, are particularly essential. In fact, now the research is showing that 10 different colors a day, 60% reduction in heart disease, cancer, and other chronic diseases from diet, specifically multiple colors a day. Essential fatty acids, of which these are a part of them. We can do them in seeds, ground seeds that are, whether it's flax, chia, hemp, sunflower, sesame, or pumpkin. Some combination of those using fish oil or hemp oil or flax oil or borage oil, evening primrose oil can come into play as far as supporting that particular aspect of things. Hopefully by now, and hopefully everybody listening is using probiotics because of the whole idea of what's happening in your digestive system is so critical in the long-term aspect of things that we need to support. And there's now so much research on probiotics that without probiotics we would have a hard time surviving. And you see that little plate there, 70% of our immune system, out of 10 people, 8 out of 10 adults report some digestive issue. It has more than 500 types of organisms. There's up to a 10% of the individual daily energy needs can be derived from byproducts of the gut flora. Goes without saying, this is absolutely now critical aspect to be supporting. And if energy is one of your issues, be surprised to just start taking some probiotics to see how that would affect you. So these are sort of some standard ways of things that, avoiding foods that are problematic, obviously. If you have local pollen allergies, they always say eat local unpasteurized honey, because obviously there's going to be tiny amounts of pollen in there. It allows the immune system, without overreacting, to react in a positive way. So that's been around since grandma's day. You see a whole host of nutrients that support the liver through all these detox pathways. And so it's not like, well, my God, I can't take 50 different vitamins. So thankfully, you can combine them and put them into, specific formulas that would be particularly helpful and particularly beneficial. As this also shows a variety of, so we know that vitamin B, vitamin C, vitamin E, minerals, NAC is N-acetylcysteine, particularly helpful for the lungs. B vitamins are helpful for everything. We know glutathione is a support for your immune system. So we have lots of ways that we can support, things for what's going on. Yes, and local bee pollen is absolutely essential. These are just a few of the different types of supplements that have proven to be helpful and effective. And once again, they're buying time. They're not solving, they're not fixing, they're not the cure, let's put it that way. But they are definitely palliative, which means they're helpful and very supportive. And so, when I treat somebody with allergies, it's very common that a number of these different types of products are part of their protocol. But the whole idea is that it may take months, if not years, to build them up to a point to get all these organ systems in balance, so that they are critical, and it is possible that they basically say, I don't have allergies anymore, which is what the whole goal is, because normally we shouldn't have allergies, but since 40 to 60% of the world is presenting at that, but we already talked about all those factors and all those features that play a huge role. So vitamin A, vitamin B, vitamin C, vitamin E, zinc, probiotics we mentioned, the hemp oil, flax oil, fish oil, et cetera, et cetera. And then these bioflavonoids, quercetin, hesperidin, catechin are specifically three types of things that are particularly helpful and beneficial for what's going on. I have to talk till they stop barking. There are also a number of herbal medicines that have been proven and are useful once again, and you can drink them as teas, you can take them in capsules. They contain a variety of very supportive things. And what are all these doing? For the most part, what they're doing, they're trying to stabilize the cells. They're trying to stabilize mast cells. They're trying to stabilize basophils, so that we don't get the release of all these triggers per se. That's buying you time. So once again, look at all that. Change your thought. You have to change your thought process. You don't start taking an antihistamine thinking, oh, my allergies are better, I hope I'm going to grow out of it. Yes, the goal is, as you strengthen your system, you do grow out of it. So these things are all supportive. They're not curative. Our goal is to be curative in time, which is really what we would like to do for what's going to happen. Those of you who are familiar with homeopathy, there are a whole variety of homeopathic medicines, including the few that I've listed there. Allium cepa, which is onion. So you can, if you understand homeopathy, if you're peeling an onion and your eyes are crying and burning, that's so like yours like idea. So the homeopathic Allium cepa potentially could be helpful for that type of a situation. Euphrasia, which is eyebright tea. It can be used locally for when there's eye symptoms, this acrid discharge from the eye. Nat mur is table salt, has an amazing supportive, has a lot of support for the kidney itself. Liver and kidney are big parts that go on. Nux vomica, it supports the liver. Waiithia is typically by people who have itchiness in the back of their throat. Is a common. These are but a few of the many homeopathic remedies that are available to us, but they can buy us some time over time. There's also specific drainage remedies depending on the practitioner that you work with for what's going on. So whether they're numbers or homeopathics or chemotherapies or phytotherapies or oligotherapies or organotherapies or tissue salts, and while we may be, so I use all those remedies on there. Once again, I always tell the patient, I'm not trying to treat your allergies. I'm trying to treat the reason you have the allergies. And I would say that's what more these types of products are doing. Yes, there are some that we could say are specific to allergies that help allergies, but more importantly, these types of remedies have a much bigger impact on looking at what is underlying the problem. What is the problem that the person has experienced? What is the true cure to that? So that we don't have to take these remedies, we don't have to take over the medications, we don't have to, not that it's bad to drink herbal teas. Yes, we will probably take vitamin C and vitamin B forever. Yes, we will probably do probiotics. In fact, I recommend that you do. Yes, we will take minerals as just general support, but that's general support for all the organ systems, not just specifically for the allergy itself, for what people are experiencing. I would be remiss if I didn't mention the importance of hydrotherapy, once again, from a local perspective, but also from a multiple organ system support. Castor oil packs, constitutional hydrotherapy, alternating hot and cold over the sinus if the eyes and the sinus are the particular areas. Using a removable shower head so that you can do alternating hot and cold to different body parts. Hot foot baths sometimes can be very helpful. Nasal lavages, nebulizers. So there's a great variety of different types of approaches. Once again, hydrotherapy, drainage remedies. I tend to think of looking at the whole person, not looking specifically at them and that's why, of course, these remedies are recommended for whatever the person is coming for, whether it's an allergy or cancer or an autoimmune disease or a digestive upset. It's irrelevant. It's, the name of the disease is not the problem. The reason that you have it is the issue, and we know that these long-standing, true, proven therapies are really which will move you the closest as we focus in on balancing what we've talked about as the terrain of the person, which is the individual aspect of what we're truly looking for and what's helpful. So palliative relief is, important and it's helpful, but the bigger picture from an ethical perspective is to look for, can give you specifics in saying, what should I take here, or what's the specific, or how much vitamin C should I take? We can't do that on a webinar type thing, but you should look for a complete assessment. My clinic obviously is in Scottsdale. The Biomed Center in Providence, Rhode Island will be another one which will have the ability to do a complete assessment. So the whole idea is to take these ideas, over a period of time and build up the system so that with each successive allergy year, the symptoms get less and less and less. Even though you chronologically get older, you become stronger and stronger. So there's a question here that says, I have bronchiectasis at the moment. I saw lung dilation on the sympathetic side, correct? Constriction parasympathetic. How is that good, especially for me? Bronchiectasis is a type of condition, and it's often felt that it's not treatable per se. And once again, you can't look at any one aspect. You have to look at every single organ system as to, first of all, what was the trigger for the bronch? Often it's an infection. Sometimes people have had part of their lung removed because of, some type of an issue. Chronic mucus production, chronic problems that are going on. So we have to look at every other organ system to try and counterbalance that is the best way to try and deal with that. And I have to say, I truly have had patients with bronchiectasis that after treating them for a period of months and years, they don't have bronchiectasis anymore, even though their pulmonologist said it's not possible. Because if you only use medications and only look at it as a disease, yes, of course it's incurable. But with biological medicine, nothing is incurable. All conditions are curable as we work on balancing all these systems together. I don't know, I know my cells don't have enough water within or without. How can I increase it? My fingertips can look shriveled at times through the day. Does coconut water help? Generally speaking, when we look at intracellular versus extracellular, we have to look at minerals, the mineral status. What I have found is that one of the most important organs of consideration here is the kidney. The kidney, of course, is one. The liver is a filter that lets things to the other parts of the body, but the kidney is the things that try and get things out of the body. But it's important to know that for all the fluid that is constantly filtered through the kidney, what it's also in there, that fluid is minerals. And I had recently, last week or this week, a patient who drinks a tremendous amount of water. In fact, drinks way too much water for her specific body composition. And all she was doing, she was drinking it, and she was just flushing her minerals out, flushing her minerals out, flushing her minerals out. So the best way that you balance intraside the cell, outside the cell, is to do either trace minerals, colloidal minerals, perhaps a multi-mineral type of a supplement in addition to 10 different colors of fruits and vegetables where most of your minerals are coming from in general. So that's how I would answer that. Any suggestions for yeast allergy? once again, we don't treat allergies. Yeast is so you have to say, but why are we sensitive to yeast? Yeast is a pretty common thing. We're constantly exposed to molds and that kind of thing. Why do people react? Yes, it's a specific. So initially, we don't look for the specifics. We say, what else is going on in your digestive system? But what's also going on in your immune system? What's going on in your lymphatic system? What's going on in your endocrine system? What is your nervous system doing? How is the sympathetic parasympathetic balance there? There are only each of those are I just mentioned five individual components for that's going on. So though the same way. So yes, we can do all these nutraceuticals. We can do homeopathics. We can do drainage remedies. What we mostly need to do is support multiple organ systems to build them up. The bronchiectasis mycobacterium, yeah, it's a pretty common one. That's usually what's underlying that. So we have to basically, as I just mentioned, we could talk about the same 5 systems with that particular individual, and how to, all the ins and outs that are required to be able to do that in general. All right, we've reached right at our 90-minute mark. But I would just like to make a comment about things that are upcoming. First of all, that a reminder for those of you who really would like to have an in-depth exploration of, Science Week and Medicine Week in Baden-Baden, Germany, from October 30th to November 5th. Early bird pricing ends on June 30th, just in a couple of days. You can go to the brmi.online/medicine week 18 to get more information about that. And next month's presentation will be on a Tuesday, not a Thursday, but Tuesday, July the 24th at 7:30 Eastern or 4:30 Pacific. From that aspect, and they'll be talking about what is the difference between bioregulatory medicine and functional medicine or conventional medicine. So, we will of course keep doing these presentations for your edification. If this information was valuable, we encourage you to share it with your family and friends. Go to the website. Within a few days, it will get posted onto the brmi.online website. So you can always find information there. You can find the past ones by going there with a /webinars. So always appreciate you joining us for this evening, but share it with people, because I know there's a lot of people out there who have specifically the problem associated with allergies, and there are other tips that can be offered in addition to just trying to run away and hide from the problem. But let's build our systems up, which is the whole idea of what biological medicine, bioregulatory medicine is really all about. And we want you to feel better, but we truly want you to be cured, not just to feel better. Thanks for your time. Thanks for joining us. We'll talk again. Have a good evening, everybody. Bye now.